Hello, this is Wildcat 5E, Team 6705, next safety episode, and today we're going to be talking about first aid, competition safety, and the pit. So, what is first aid? This link again, and some other links, will be in the description of this video if you want to take a further look at them, and I encourage you to do so. But what is first aid? First aid refers to the medical attention that is usually administered immediately after the injury occurs and at the location where it occurs. It is often consists of a one-time short-term treatment and requires little technology or training to administer. First aid can include cleaning minor cuts, scrapes, or scratches, treating a minor burn, applying bandages and dressings, the use of non-prescription medicine, draining blisters, removing debris from the eye, massage, and drinking fluids to relieve heat stress. So this is just a basic overview of first aid. This is from OSHA, the Occupational Health and Health Administration, and this again will be in the description in the form of a link. So what you need to have in your first aid inventory, your first aid kit, is largely dependent on what emergencies you are training to be able to, I guess, do first aid on or perform effectively. And so it's going to be mainly based on what you have in our emergency binder. And so to cover the list of first aid items and emergencies you should be able to do, you should go to Mayo Clinic, as we discussed in the emergency binder episode, to find the list of first aid and then receive the information of how to treat it and put it in your emergency binder. And so when it says a certain treatment, it might say to do a certain thing, you applying an antiseptic, for example, or just applying gauze to a wound. So because of that, you want to make sure you have that in your first aid inventory. You should document this and have this as an official document in your drive, so you can keep easy track of it to know if it has been used at all, and to also know what materials you have in order to treat various emergencies. And see what in general you want to base this on whatever your emergency binder requires you to do, based on whatever first aid you're trying to perform. And so you just have, for at least ours, just a first aid guide, bandages, mini bandages, medical tape, gauze, aspirins, tweezers, safety pins, bandage scissors, medical tape, instant sting relief, burn cream, antibiotic ointment, instant cold pack, wound wash, just many different things you should have. Alcohol pads for disinfectant. There's various things you should have in your first aid inventory to enable you and your team and your safety program to adequately treat any emergency that arrives. So this again will be a link in the description. I'm just going to go through some of the basic first aid things. For example, an unconscious victim. If the victim is unconscious, you should perform rescue breathing, explain below, and explain later. If the victim's heart stops beating, perform CPR if you have been properly trained to do so. And the next thing is shock. Shock, for treating shock, the signs to notice are clammy skin, pale face, chills, confusion, frequent nausea or vomiting, or shallow breathing. And until emergency help arrives, you should lay the victim down and have the legs be elevated, and keep the victim covered to prevent chilling or loss of body heat, and give non-alcoholic fluids if the victim is able to swallow and has not sustained an abdominal injury. For bleeding, until emergency help arrives, you should put a rubber or latex gloves on before touching any blood to prevent infection. And then you should put some sort of pressure, either finger or hand pressure, to control the bleeding. And if that's inadequate, you should make sure to put a clean cloth or bandage over the wound and hold that in place, either with a belt or just directly, and to secure it. And so the constant pressure is applied to the wound, and do not stop the circulation to take care not to stop the circulation to the rest of the limb. And for injuries where such securing should not be used, then a thick pad or clean cloth can be directly applied over the wound using just your hand pressure if you don't have a securing material. And if bones are not broken, you should raise the bleeding part higher than the rest of the body. If the injury is extensive, the victim may go into shock, and you should treat them for shock as well. And as a last resort, you should have if you have a tourniquet, you can use a tourniquet to stop the bleeding. And it is a wide banded cloth or other material tightly placed just above the wound to stop all flow of blood, so the victim does not lose excessive blood. And so you have to wrap it around and tie really tightly, and then tighten it. And then you should also put a date on it, a time on it when it was the tourniquet was applied on, just to make sure that the physician who will take over knows exactly when it was on, and then they will remove it, not you. For burns and scrapes, you should just immerse the burn area and tap or cool water, or apply a clean, cool, moist towel. Do not apply ice. Do not use ointments. And then for severe burns or chemical burns, treat them for shock if needed. Remove clothing. If the clothing sticks to the burn area, leave it there. And then for chemicals, flush the skin with plenty of water, but only cover the exposed area with a clean bandage if the chemical has caused the burn. The burn victim is conscious, can swallow, does not have severe mouth burns. Give plenty of water or non-alcoholic foods to drink, and get them to a physician or hospital as soon as possible. And for spinal injuries, now move the limbs of the person, and if the victim must be moved, keep the torso and neck of the body as straight as possible, and pull the direction that keeps the victim's spine a straight line. And when providing patient care, it may be necessary to roll the victim on the back to clear an airway or evaluate breathing. When rolling the victim over, the head, neck, and torso should be moved together so no twisting occurs. And then for rescue breathing, when breathing movement stops or lips or tongue and fingernails become blue, person needs immediate help, and so apply rescue breathing in these 10 steps below. You should make sure they are actually needing help. You should just shout, "Are you okay?" Shout help to other people and get them to call a physician and emergency help immediately. And then roll the person onto their back slowly towards you. You should lift the chin and clear the mouth of any obstructions, and check for breathing for 3 to 5 seconds. Then you give 2 full breaths with the head tilted back. Pinch the nose shut and seal your lips around the victim's mouth. Give 2 breaths for 1 to 1 to 1.5 seconds each. Check for pulse, and then continue rescue breathing until help arrives. And for choking, you're going to be doing abdominal thrusts for children, and for children over 1 year and adults, you should make sure, again, ask if they need it, such as shouting, "Are you choking?" Should you help for EMT to arrive? And then doing abdominal thrusts, wrapping your arms around the victim's waist, making a fist, and place the thumb side of the fist on the middle of the victim's abdomen, above the navel, and well below the lower tip of the breastbone. Grasp the fist with the other hand and press the fist into the abdominal with a quick upward thrust. Repeat until the object is coughed up or the victim starts to breathe or cough. If the victim becomes unconscious, lower the victim onto their floor. And do a finger sweep, grasp the tongue in the lower jaw, and lift the jaw, slide the finger down, and slide the cheek of the base tongue to sweep the object out of the airway. And then give 2 full breaths, and then do rescue breaths, as explained above. And if the victim is less than 1 year old, place the victim in a downward position, and then with the heel of the rescue hand, administer 5 rapid back blows between the victim's shoulder blades with the victim's head and neck stabilized. If the obstruction remains, turn the victim's face up and rest on a firm surface. Deliver 5 rapid thrusts over the breastbone using 2 fingers. If the victim is still not breathing, administer mouth-to-mouth resuscitation, and repeat the steps above. If the obstruction cannot be removed, call for immediate medical help. And then this is another link. It has some additional information such as like poisoning. And then just for a first aid checklist, just the basic first aid kit info you need. First aid kit materials you need to have is adhesive bandages, butterfly closures, gauze, non-stick sterile patch, first aid tapes, and then items such as tweezers, first aid cream, and thermometer, and an ice pack. The next thing we're going to talk about is competition safety. Competition safety is very important, just to make sure that everything goes smoothly and there's no hazardous situation at a competition that occurs. And this is from the first official safety manual, and some safety considerations is just to refrain from dangling jewelry or loose bag of clothing near the robots, tie the hair back, wear gloves to protect hands and fingers when handling the robot or a robot crate. And then to gain entrance to the pit, every person will have to wear a pair of safety glasses or equivalent if they have already glasses, and then use safe lifting procedures, and do not use skateboards or bottled gas cans, or do not throw objects. And then just make sure that when entering the line that differentiates stands from pit, make sure everybody on your team has the safety glasses on. And for competition safety, you should use a buddy system when traveling at the event, so no person is alone and potentially can get lost or abducted. And then stay aware of your surroundings, demonstrate the safe behaviors of all times as usual, and then have proper lifting procedures, and make sure the robot is properly secured if you need to work underneath it. And then also assist, mentor, and other teams with safety issues. And then for your competition, you should make sure that you have a secure exit route and evacuation procedure if needed. And because of that, you should look up wherever you're going and to see where you can actually meet. They'll usually have a facility map to meet at, the facility map, and you should mark on that map potentially where to meet at for your team, and you make sure you communicate all that information to your team. And then also on the competition safety, you need to make sure that when moving the robot, you should not yell, but you should say in a very loud, clear, distinct voice, "Robot." And so other people at the competition venue, and especially in the pit area, knows that you're coming through with the robot and knows to move out of the way. And then for the pit rules, is basically mostly just all the workshop rules do apply. And these are just the basic pit rules that you need to have at the competition, mostly based on the pit station here, such as bring your gloves, design pit station safely, use ladders, don't climb, and just control access, keep it neat and orderly. Proper use of power strips, do not daisy chain, plugging the power strips into each other to overload the rated capacity of the power strip, and then do not build any structure that is not secure or anything like that. You have to securely mount team pit signs, banners, or displays. You have to also be aware that your pit is a 10 by 10 by 10 volume, and so you do not exceed maximum height, which is often an issue. And also make sure that children under 12 must have a person 18 or older with them at all times in the pit area. And there will be child safety classes available to borrow on return at the pit station. And then just other pit rules might be repetitive, but it's good to go over them. Safety glasses must be worn at all times. Keep it clutter-free. Put your rolls on their side and neutral. Keep the chuck keys in the drawer, and only put them in when you're using the card machine that needs a chuck key. Keep the floor clean. Keep the pit clean in general. It's not to have any excess debris or any litter on the ground, because that can potentially become a hazard. And then no daisy chaining. Store tools in their proper place, which will just maximize efficiency. Keep personal belongings to yourself. Always wear closed-toed shoes. No loose hanging jewelry. No horseplay. Listen to safety captain, coaches, and mentors. Tie up long hair. Follow the pit schedule, and be aware of your surroundings. And so just other thing to note is that you should organize your pit via communicating with your various leads of your engineering and building side to make sure that they can get to all their needed areas very efficiently. And you should design the pit so it's the easiest access for the most people involved when working in the pit. And then just make sure that's the safety info, especially the emergency binder, and then just the binders in general, and then all the safety stuff such as a fire extinguisher, battery spill kits, or first aid kit are easily accessible in the pit. So just want to thank our 2020 sponsors for Team 6705, Wildcat 5e, GPS Hospitality, AXA, Excel Insurance Free Insurance, Griffin Engineering, Vision Metals. Thank you for tuning in, and good luck in developing your stage program. Thank you.